Today, I want to talk about something that is confusing in the perimenopause, menopause world. Have you been told, or have people in your life been told, that no, you cannot benefit from HRT because you still have a period? So, no hormone replacement therapy until your period's done. It's a really common thought or school of thought by different healthcare providers. And I'm here today to tell you that that's not true. Perimenopause can happen 7 to 10 years before your period finally stops. You will continue to cycle, and yes, there will be changes. Sometimes they're subtle. Your cycle will be shorter and then longer. Maybe you'll skip one. They'll become more sporadic and less regular the closer you move to menopause. However, you do not need to wait until your period is completely done, so 12 months without periods, before you start hormone replacement therapy. That perimenopausal period is full of symptoms. Our bodies are covered in estrogen receptors, and as estrogen starts to deplete and we ride that wave in perimenopause, it's going to present differently for all of us. So I might have dry skin and a ton of urinary symptoms, and you might have a lot of anxiety, weight gain, hot flashes. It's going to look different for every single person. But there is treatment. You have options in perimenopause. You do not need to wait for your periods to be done. What are a few of your options? The birth control pill. That is one option. But you need to know that is substantially more hormone than hormone replacement therapy. It's a lot larger dose, and it's also not bioidentical. It works for some women beautifully, but it can cause more genital urinary symptoms. But if you loved birth control, if you took it, earlier and it worked well for you, you might, it might be an option for you. The other option is progesterone. Some women start there. So sometimes the common symptoms when you're first perimenopausal are sleep disturbances. So you have a hard time falling asleep in that second half of your cycle, and you notice increased anxiety. Progesterone at bedtime can help with that. And of course, you need to talk to your doctor or your healthcare provider about this, but I want to inform you that you have options. Some people choose to take progesterone for only part of the month, and some people take it all month long. There's a lot of benefits to that, and you can do it while you still have a period. Then some people choose to add estrogen into their regime, even while they still have a period. You need to know that that's an option. And depending on what symptoms you're struggling with, it can make a huge difference. And there's a ton of different routes, and there's a ton of different doses. And yes, you can have it while you still have a period. And then the other option is an IUD, so an intrauterine device. And these can work wonders if you're having a lot of issues around heavier periods. And it can be used in conjunction with other things as well. So estrogen and also oral progesterone. That's such a brief overview, but what I want you to know is you do not need to wait until your periods are done if you are struggling. If you want more information, reach out to my team. We can find you the nearest practitioner and get you some support and get you feeling better.